The surgery I'm having is an anterior cervical discectomy and fusion. Lots of big words, but it just basically means that I have a slip disc in my neck. Kia ora, ko Stephanie tuka ingoa, haere mai, welcome to Adaptive Go. Hi, my name is Stephanie, welcome to Adaptive Go. I'm having surgery tomorrow and I'm feeling nervous and excited about it, and I wanted to talk to you about the sorts of things that I've done to prepare for surgery when I have a chronic health condition. The surgery I'm having is an anterior cervical discectomy and fusion. Lots of big words, but it just basically means that I have a slip disc in my neck. They're going to take the disc out, pack it with a cage and do a bone graft from my pelvis, and then put a couple of screws in and a plate to hold it all together until the two vertebrae above and below the disc fuse. So pretty really big surgery, but not massively complicated. That slip disc is causing a spinal cord injury through my body, and I also have an underlying health condition called inflammatory arthritis, where I have features of rheumatoid arthritis and also spondyloarthropy. What happens when you have inflammatory arthritis is when you're injured, your body overreacts to the level of injury and will have a much bigger inflammatory response than what you'd normally expect. So surgical outcomes can be, it means that you can get some more swelling than normal at the surgical site. It can take slower to recover. So those things sort of make it feel a little more scary, and it's been quite difficult wrapping my head around it, but I've got there and now I'm in a really good place and looking forward to the surgery. So I thought if there were others like me out there who were getting ready for surgery but wanted some ideas about how to get into the right space, then I've got 3 big tips for you. Tip 1, get informed. Knowledge is power. I say it all the time, but the more you know about what's going to happen to you and what's going to happen to your body, the easier it is to prepare. There's lots of different ways that you can do this, and probably the best way is to talk to the specialist or the doctor who's doing the procedure. They might be able to give you additional information, resources, YouTube clips, whatever, to be able to help you work through what the procedure is going to do to you. For me, I found a couple of clips on YouTube, 2 from a specialist, one explaining why you need to have the procedure and another one explaining the procedure itself. But you need to be really mindful when looking on the internet. Just to protect your mental health. Don't look at those vids that are scary or horrible or talk about lots of adverse outcomes. You want to look for stuff that's going to make you feel good and it's going to take your worry away, not add to it. And it's also a really good idea to check back whatever you've watched with your health professional, just to make sure that you've picked up the right things and that the vid that you've watched is relevant, is right. Another thing that I did that was really, really helpful was I looked at patient videos. I watched 2, I watched more than that, but 2 that I found that were really good. They both had really good treatment outcomes, but what was really useful was they had really good practical tips around how to help me recover from my surgery. Things like using bendy straws, the types of clothing that you can wear, all those sorts of things. And so that gave me confidence and helped me to get prepared. The other place that you should also get information from is to talk to your underlying specialist who's treating your underlying health condition, and talk to them about the surgery and get an understanding from them about what might happen to you with your health condition. So I spoke to my rheumatologist and she was amazing. She talked to me about all the positive things, like that I was in a really good space to have the surgery, that my health condition was under really good control, all those things that I really needed to hear that were reassuring. And then she also did a really good job of preparing me by talking to me about the inflammatory response and that surgery recovery might be a little bit slower than normal and that was okay. Another thing you can do is find other patients who have had similar procedures and talk to them about how they went through the procedure and the types of pain that they experienced. I couldn't find anyone like this. There was one person in one of the Facebook groups that I belong to who'd had a similar surgery, and he talked about it, and his few comments were really, really helpful. But that's where the patient videos came into was the strength of watching those YouTube patient videos, because they showed me that the pain isn't going to be anything more than what I've already experienced. It's going to be stuff that I can cope with, and that they have medication ready and to help with the pain, and at the hospital they have put lots of wraparound care in place to make sure that when you go home you have everything you need. So the patient videos were really reassuring from that perspective, and I understand more from a patient experience about what the pain feels like and the sorts of intensity that's going to be. So if you can find the right vid, I highly recommend it, or if you can find someone to talk to. My second tip is get prepared. This is where the patient vids that I talked about earlier were most helpful. You might also be able to look in some of the websites with the written material around the sorts of things that might be good to have post-surgery. And if there's equipment that you need, find out before you go into surgery whether you need to get it yourself or whether an agency or the hospital will be able to support you with that sort of stuff. Some of the websites I talked about, you know, getting rid of clutter, clearing your house out, you know, all that sort of stuff. Look, I don't know about you, but getting ahead of surgery, you know, if you're having surgery, life's pretty challenging. So, and you want to be going into the surgery not feeling super tired and exhausted. So I think while it's a good idea to have things tidier so you don't come home to stress and tripping over things, I think also it's a case of just being realistic. Just do what you can and know that, you know, when you recover, there'll be time for all that stuff. My last tip is get your head in the right space, and this can be really, really challenging. Like I said earlier, I was really struggling with it, and I know some of the friends and family that I've spoken to have seen me struggle with needing to have the surgery done. And for me, it's particularly difficult because the surgery is not necessarily going to fix anything. It's about stabilising where I'm at, because spinal cord injury tends to be a little bit permanent. So that makes the surgery quite a difficult sort of mind game, and I spent some time really bolstering my attitude and approach to surgery, and it's really made a difference to me. So one of the big things I did was I started practicing mindfulness. I do this anyway, but I just paid a lot more attention to it, did it more often, and it really made me appreciate and be grateful for the things that I have in my life right now. And even if I'm not any better off after surgery, I can really appreciate and enjoy the life that I have at the moment. And so that was really helpful. Just be careful with this mindfulness thing as you're heading into surgery that you don't get Last Supper-like. You don't want to be getting into that sort of mind game. So yeah, mindfulness and just appreciating and taking time to appreciate the good things in life and what's happening to you right now. Another thing that you can try and do is meditation. I've been picking this up. I practice it on and off, but I've been putting it in place a lot more in the lead up to surgery, and it's been super helpful. Just the meditation, the practicing the breathing, calming yourself down, slowing down. When you get that sort of panicky feeling, oh, it's coming, you know, just breathing and slowing down. And focusing in on the good things. Those things have really, really helped me get my head in the right space. However, if you find the anxiety getting too much for you, or the worry sort of overcoming, and you can't get your head in the right space ahead of surgery, have a chat to someone, either a friend, a health professional, a psychologist, your GP, a specialist, anyone that you feel that you can talk to. One of the other things that I have tried in the past is there are apps available for helping you work through anxiety. I use Just a Thought. If you're going to use an app, this Just a Thought one, it's a sort of a 6-week kind of course, so you sort of allow yourself some time to do that. Yeah, and so that can also be a really helpful way of just sort of helping calm things down, because I think at the end of the day with the surgery, we can't control the need for surgery. It's happened, our bodies have reacted the way we have, and we have to have surgery to either put things right or stop things from getting worse. So we can't control that, we can't control the doctors, we can't control what happens in the table, and in many elements we can't necessarily control what happens through our recovery either, especially if you have an underlying health condition. But what we can control is how we feel about it. We can get to the point where we know that we're going to be able to manage, we can cope, it's not going to be anything worse than what we've had or experienced in the past, and by getting in control of our emotions and our thoughts and feelings, we set ourselves up for success post-surgery. And if the surgical outcomes aren't what we intend, then we're in a really good space to deal with those. So it is worth spending a little bit of time and energy and effort making sure that you're in the right headspace, getting ready for surgery. So I hope these tips have been helpful for you if you're heading into surgery and you have an underlying health condition like inflammatory arthritis. And yeah, so subscribe, and I'll catch you next time. Ka kite.